Good evening. Thank you for joining me. It is important that we have a common understanding, so we welcome your questions and we'll plan on doing this daily at 4 p.m. to answer evolving questions and provide updates. As stated previously, we individually are the first line of defense and need to be watching what we and others do. With so many changes happening, it is critical that we maintain communication and accountability. Each of us should be checking in with our supervisor daily. Now let's get to our questions.
Sir, I live on post. If someone in my household shows positive for COVID-19, where can I get a face mask?
It's important to understand that COVID-19 is a reportable disease, and any confirmed cases will involve the health department. Currently, the health department will work with families to obtain and use and dispose of masks and respiratory systems as needed. In our experience, many hardware stores sell a dust mask if you're concerned. The primary purpose of a face mask is to prevent individuals who are sick from spreading germs to others.
Sir, the CDC has stated that certain types of locations are high-threat zones for COVID-19. Our staff has concerns about working at the Bell Gym facility. We have been cleaning and taking preventive measures, however, we are at high risk. Other fitness centers around the area have taken precautions for their employees by having them not exposed to large communicable areas. What is the strategy or procedures in place to mitigate the risk for our staff at Bell Gym?
Every one of our teammates in our workforce is critically important. I think it's important to understand that the mission of Bell Gym Fitness Center is to facilitate soldier, sailor, airman readiness, and therefore follows a different set of protocols than our for-profit commercial fitness centers. Family and FMWR will adjust operations as the threat evolves, but right now, facility operators are disinfecting equipment at least once per hour and after every class, and making sure we're practicing social distancing during the classes. Additionally, if you're using the gym after hours, wipe down what you're going to use before and after using, just to be double sure that you're taking care of yourself and the folks that come after you.
Sir, since El Paso is the largest population center in the area, recommend adding the Texas Department of Health website to the COVID-19 monitoring site on your social media sites.
This is a great reason why we're asking for questions. I mean, who could forget that a lot of our population lives in Texas? It's a great recommendation, and we've already added the Texas Department of Health to the website. Our both internal and external WSMR pages have got a COVID-19 button. Press it, and you'll see the link there.
Sir, we received several questions about telework and leave status, given different scenarios.
As with many answers today, each scenario can be different and will involve discussions with supervisor, employee, and in this case, likely the CPAC. As a general guide, CPAC has provided a reference which is now available and posted on those web pages that I talked about. Also posted is the latest guidance from OPM, which is evolving. The answer to any particular scenario is going to depend on all of the eaches of that scenario. So have the conversation with your supervisor, and if you've got a general question, look to that chart that CPAC has provided us.
Sir, we currently live on WSMR. I have a pre-existing health condition that requires me to travel back to San Antonio to see my specialist for follow-up care and prescription refills. My next appointment is in April. My husband is not allowed to travel. What should I do?
Thank you for reaching out and being proactive. First and foremost, if you've got a concern about your health and future appointments, call your provider. They are aware of ongoing pandemic and national emergency and may be able to provide alternatives to travel.
Sir, what is being done to allow one of the parents to stay at home while the public schools are closed?
Start with your supervisor. We are maximizing opportunities for alternative work schedules, telework, and liberal leave, and working with your supervisor should be able to find an answer to your particular challenges.
Sir, as a new employee, I only have a very few hours of paid sick leave, which is worrisome since I cannot afford to take leave without pay. What are the options for employees like me?
Again, start with your supervisor. Advanced sick leave may be authorized. Additionally, we're maximizing opportunities for alternative work schedules, telework, and liberal leave.
Sir, why have other local military installations curtailed operation and moved to minimal manning telework, and WSMR is operating as normal? What is the local area for military, as stated in the DoD memo dated the 13th of March? Other installations around the country have leadership defining it as a certain number of miles, as in 50 to 100 from the installation.
Well, that's really two questions. So let me break those apart. On the first, note that WSMR is not operating as normal. And WSMR has a unique national security mission that continues. And we should expect WSMR to be different than other military installations, just like it is every day. On the question of the local area, we're defining the local area as based on your domicile, where you live, and your work location, and providing a 100-mile radius around that. Understand that if you are not taking precautions, you can be susceptible within a mile of your house. We all need to think and exercise common sense as we look at that local area.
Sir, what are the plans for the dining facilities on post? Will they continue to operate like normal, change to pick-up, to-go options, or are they at risk of shutting down?
We have increased cleaning and disinfectant protocols and are practicing social distancing to continue to provide meals, understanding the limited alternatives at WSMR.
Sir, are there additional questions and screening measures taking place at the gates, or is it up to the leadership in each individual building to screen visitors and employees? What is the plan if and not when WSMR has a confirmed case of COVID-19?
So our pandemic response plan is extremely detailed and includes all the potential alternatives and allows us to respond to various levels of threats by COVID-19 and prescribes approaches to stepping up prevention and controlling activities as threats increase. Currently, if you're expecting a visitor, ask them 3 questions. 1, have you traveled to or through a level 2 or 3 country in the last 14 days? 2, have you been exposed to COVID-19 in the last 14 days or feel that you have COVID-19? 3, are you feeling sick today? If the answer to any of these questions is yes, please have them call medical professionals for further instructions.
Sir, can a person have both the flu and COVID-19?
As bad as it sounds, the answer is yes. Consult your provider if you have specific concerns.
Sir, are we able to telework without a VPN computer? For example, take home unclassified printed reports that we need to read and review?
Every situation is different. Telework is an agreement between the employee and supervisor. But understand that under no circumstance should you be using your personal devices to process official government email or documents.
Sir, do you anticipate that we will continue to have uprange access for those of us who have field work to do?
WSMR has a unique national security mission that will require continued access uprange for some.
And finally, sir, what is the plan on WSMR for base children out of school?
We are increasing opportunities to enable parents to ensure they are taking care of their children and can still work. This includes extended CYS hours and increased screening. Teleworking, given the declared national emergency, can occur while children are at home, with the understanding that hours need to be adjusted to ensure a full day's work for a full day's pay. As an example, this may mean working 12 hours to accomplish the 9 hours being paid for. Additionally, let's be clear, parents are responsible for their children and need to be proactively involved, ensuring they are taking the preventive measures directed of everyone. So, let me close with the importance of taking care of yourself, your families, and the people around you. We are the first line of defense for ourselves by maintaining good hand-washing habits and practicing other daily health routines to minimize the spread of germs. If you are sick, please coordinate with your supervisor to take sick leave or make alternative work arrangements in order to protect others. You and your families are critical to the WSMR mission, and we are fortunate to have such a dedicated team and workforce. Maintaining your trust and good health is among our highest duties. Please, if you've got questions that we haven't addressed, ask them, send them in, and we will roll them up and be with you tomorrow at 4 p.m., 1600 local. Thank you.